Hello, and welcome to the Holistic Nurse Academy, where we blend and bridge Eastern and Western medicine. We're bridging the gap between Eastern and Western medicine, let's say it that way. I'm Holly Taylor. I'm a registered nurse and a board certified holistic nurse, and recently cranial sacral therapy techniques certified. I've got a wonderful guest today. I'm excited to have this conversation with Dr. Aubrey Madsen, who's a chiropractor. Um, say hi to the group.
Hi.
Before we start, though, I do like to read the bio of our guest, so I'm going to do that for you first. So hang on one
Okay.
second. Dr. Aubrey Madsen is a holistic chiropractor. She is the founder of True Function Holistic Chiropractic, where she takes a root cause, whole body approach to healing. Her work blends chiropractic care with muscle activation, personalized nutrition, and cold laser therapy to help patients restore function and get back to living fully. Dr. Madsen has long been fascinated by the body's innate healing process and intelligent design behind it. Her curiosity has driven her to study the intricate relationship between the physical, emotional, and chemical aspects of the body. She believes the body is naturally programmed to heal, and her role is to remove interferences so the healing process can unfold. She has a passion for understanding how nutrition influences all systems of the body, especially emotions and brain function. Dr. Madsen earned her bachelor degree of science in exercise with fitness and wellness emphasis, along with a minor in nutrition from Brigham Young University. She went on to attend University of Western States, where she received her doctorate of chiropractor degree in December 2012, Rather than chasing symptoms, she focuses on identifying and addressing the underlying cause of dysfunction so patients can feel and function at their highest level. In her spare time, Dr. Madsen enjoys refinishing furniture, running, practicing yoga, and bargain shopping. Love that for you.
Oh, thanks.
Bargain shopping. I wish I was a bargain shopper. I'm not.
Uh, it's like my sixth sense, I think.
Some people have it, some people don't. This is what I say. I
I
don't
didn't know that.
I don't have it.
Oh,
Well,
darn it. I'll teach you.
thank you. Well, I'm honestly so excited to have this conversation because I want to know, and we'll get to this, but I want to know why there is such a chasm between chiropractic care and I want to call it modern medicine, but I think chiropractic care is part of modern medicine, but Eastern
Yeah.
and Western medicine. So before we go into that, though, because I feel like we could go down a rabbit hole pretty quick.
Mhm.
But that is why I'm excited, because I want to have this discussion where um, we talk about how we can get along a little bit better. However, I want to know where this all started for you, as far as becoming a chiropractor, and if you could tell us what chiropractors do, what kind of defines a chiropractor? What's the history there?
Well, I'll probably start with how I got into it. Um, I was actually doing a summer job at Gandolfo's and making like $6 under the table. And I think that job only lasted 2 months because I ended up becoming a chiropractic assistant. And I
Oh,
just walked at the very first place I went to, well, I was their
mm-hmm.
catering manager. So I was going business to business and asking if they wanted us to cater their, you know, business meetings or something like that. The very first place I went was right across the street from Gandolfo's, and it happened to be a chiropractic office. And I had no idea what a chiropractor was, I don't think, at that point. And I just thought, wow, I don't think they're going to want this type of food because I think they have something to do with health, I don't know what it is. So I walked in, talked to the receptionist, and she was just really nice. She was this sweet older lady. And she, instead of being like, get out of here, we're not interested, she just got to know me. And she was asking what I was doing for school and different things. And when she found out I was doing exercise science, that's a program I was in, she goes, oh, we need you to work here. And so she went and got the doc and brought him up, and I met him. And long story short, I ended up getting a job as the chiropractic assistant. So that was my first introduction to chiropractic. And during that time, I had my own back pain. And so I would get chiropractic adjustments probably, I don't know, anywhere from 2 to 4 times a week. And it always helped temporarily. And then for like a day or two, but I kept running on it. I was trying to run, about 3 miles at a time at that point. And it wouldn't stick. We couldn't get the benefits or the improvements to stay. And then fast forward, I ended up being introduced to muscle activation, and that is in the long run, that's what helped me really solidify um, improvements in getting rid of the back pain. And so that it was because of that specialty with the muscle activation that I decided, well, I've got to become a chiropractor now, right? Um, which I was terrified to do because it's a whole lot of schooling, and I was told by the chiropractor that I worked for that we're going to be carrying anywhere from 27 to 38 credits at a time, and that was not something I felt like I was really capable of doing. And but they say with chiropractic that it's either your passion and you're called to it, or you're not, because it's kind of still a bit within our society. It's not exactly the easiest thing to be.
Yeah.
It is kind of a mixed bag on what people think about it, and we'll kind of get to that. But I think the trend is getting more and more, like you said, it's becoming more mainstream, and I think society in general is starting to understand that there's um, a lot of science to it, a whole lot of research that's been done on it now. Um, and I think that my back case was just a little bit more complicated because in general, the chiropractic adjustment can be kind of magical. It can be very beneficial. But for me, in my situation, that's how I was led into chiropractic, was the muscle activation stuff. And I went from being able to run like a mile and a half with a whole lot of pain and having to do um, icing and massage and stretching and stuff after my runs, to being able to run 9 miles, which I've only done 2 times ever. It's really close to getting healed up,
Yeah.
but it was a massive difference after about like 2 years of back pain, and then having muscle activation treatments over probably a month or two, and then I was able to increase my running by
So let's talk a little bit about, in case people haven't ever heard of it before, muscle activation treatments. What does that entail?
So muscle activation kind of works with this concept that we have this uh, optimal setting of a muscle, and the muscle needs to be able to lock with pressure, to be able to match that pressure. And this is not a strength factor. It doesn't matter how strong you are. It's a functional factor of, is the brain being able to optimally send the signals to a specific muscle, whether that's the biceps femoris or the pectoralis muscle. Can that muscle lock and relax, and lock and relax? And so that's a healthy functioning muscle. So if I was to test the bicep muscle, I'd just say, with a patient, I'd say push against me here. And if we're able to get a good lock, then we know that's functioning. But if we kind of get a loosey goosiness to it, then
Mhm.
we've got a muscle that's not optimally functioning. And so a bunch of different things can cause muscles to, we call it shut down.
Mhm.
But a few different factors we think can kind of cause that issue. And anywhere from emotional traumas to illnesses to physical injuries. Sometimes I think that the birthing process, that can be a pretty difficult situation, right?
Yeah.
Whether they're using, the vacuum or, sometimes I think muscles could be shut down then. Maybe you were 5 and you fell out of a tree. And then I think we have a certain amount of muscles that maybe need to shut down before we get pain. But once we get enough muscles that are not functioning properly, then it kind of over time pushes us towards other muscles trying to compensate, and we can get trigger points, we can get loss of optimal blood flow, which anytime any tissue in the body is losing optimal blood flow, then it's just going to equal pain.
Mm-hmm.
And we might be on the road faster to arthritic situations, osteoarthritis stuff, and then we can be more prone to injury. For a basketball player and we go up for a layup and land back down on that ankle, then we would be more prone to rolling that ankle, breaking it, spraining it, if we don't have ankle muscles that are firing properly. So
Right.
it just kind of, I think it ends up being um, more of a root cause fix to the spinal problems,
Mm-hmm.
and because that any joint is not going to have a misalignment or not be moving synchronously, unless muscles are kind of like pulling it out of place, right?
Right.
So for me, in my practice, that's kind of an added specialty to just adjusting the spine and dealing with vertebral joints and joint restrictions and stuff like that. But,
Okay.
so in the end, I feel like it tends to be getting more to the root cause, and I think it tends to be more of a permanent fix, because if you've got low back muscles or neck muscles that are able to fire properly and function, then and communicate with each other, because muscle movement is such a synchronous activity.
Mm-hmm.
If we're bending forward and also to the side, we need certain muscles to let go and relax and other muscles to be in more of a contraction state. And if all of those intricate levels of contraction and relaxation can't happen very well, then we're going to be more prone to that back pain and making different vertebrae and intervertebral segments not being able to function and move in conjunction with each other very well. So having your muscles functioning helps to prevent injury, and so in some ways make you more help with flexibility issues and stuff like that. So
All right. Awesome. Well, I want to kind of come back around to that because I know that's a technique within the scope of what you do, but I know there's lots of different techniques, lots of different options once you become a chiropractor.
that's one of the things that can be so great about chiropractic, but also very confusing
Yeah.
for the general public, because
Right.
there's a lot of different specialties that a
Right.
chiropractor can have. So if you say, "Oh, I'm a chiropractor,"
Yeah. What does
someone
that
could have a
mean?
chiropractor that specializes in lab work and the endocrine system and getting your hormones balanced. Other chiropractors are sports chiropractors, and they're amazing at taking care of concussions. And others might be pediatric
Mm-hmm.
chiropractors and really good at working with children. And so there's many techniques out there, many different modalities of helping the body. And so some chiropractors are just kind of, as we call it, the rack and crack, and they'll do a spinal adjustment every 5 minutes, and they're seeing 100 patients a day. And then others are taking a little bit more time with the patients and doing many different alternative modalities that we see these days. So
Yeah.
it can be kind of a confusing profession for the outside
Yeah.
viewers.
Well, that's exactly why I want to have this discussion is I feel like it's kind of learn as you go and word of mouth and
hmm
um but I still feel like we haven't made the implicit explicit fully with chiropractic work. So I would be interested if you wouldn't mind kind of walking us through what makes you a doctor of, you know, chiropractic work. Like what does the schooling look like? What are the requirements? It's obviously a doctorate degree. So
hmm
tell us a little bit more about that. I think even in that, there's some misconceptions I'd like to help clear up through this conversation.
Yeah. Well, we do go through a 4-year program after the bachelor's. I did finish mine in 3.5 because you could take summers off, but
Mhm.
mine was, I just went straight through and went to school during the summers. And so typically, I think each state is a little bit different depending on their requirements.
Okay.
Some states will require you to have a bachelor's degree, and others may just require you to have certain prerequisites, I think.
Okay.
And so that, like I said, that program, we're kind of carrying for, maybe we'll edit this out, I don't know, but from what I understand, a lot of med schools are built to have shorter courses and fewer at a time. But in chiropractic, what I was told was that we want you to understand not just the depth of something, like the physiology, the biology, and the anatomy, but we want you to take these classes all at once so that you understand the breadth and how they are related to each other and play into each other.
Yeah.
And so what my program looks like was, 27 to 38 credits, and we had the biologies and the organic chemistries and the histology. We had a lot of lab work classes, and a lot of radiograph courses. We had some nutrition, but that's something that I've added into my practice a whole lot more with postgraduate
Okay.
studies and extra courses. And then there's a lot of palpation classes where, of course, we've got to learn how to adjust. And so some classes are weird in the lab. There's, 20 different chiropractic adjusting tables in there, and we're taught different adjusting techniques. And even within the adjusting techniques, there's a broad scope. You've got
Mhm.
Gonstead techniques. That's the one off the top of my head at the moment. You've got upper cervical techniques that are very light and mostly focused on the atlas and making sure it's moving properly. And so even within chiropractic, there's a whole lot of different philosophies, which I kind of don't think, well, I know is not any different than any other profession.
Right.
Recently, I've had patients in with for gum disease and seeing a dentist versus the endodontist, and they are having massively different opinions. And I've had very different opinions on teeth and gum things,
Mm-hmm.
over the years, and kind of opposite opinions actually on what should be done procedurally.
Mm-hmm.
So yeah, chiropractic isn't any different in that sense. And I tell people, you can have two top neurologists in the world, and they're not going to agree on anything, which is, I don't know, kind of the beauty of this world, I guess, and
Right.
how we see things and different perceptions and everything. So,
Right.
which I think is kind of how it was so difficult in the beginning of chiropractic, because we were kind of in the Wild West era
Mm-hmm.
of medicine when chiropractic came to be with D.D. Palmer. It was 1895 that D.D. Palmer discovered chiropractic or started to develop the technique. And around that time, the US was just kind of starting to get a little bit more or solidify more regulation on practicing medicine, on medical schools. The Flexner report kind of came through at that point, which was this big study on kind of the quality of the education of medical schools throughout the US and Canada. And I think that was put out by the Carnegie Foundation. And they decided, look, we've got to have higher standards to be able to admit people into medical school and also to have them graduate. And so the whole idea of practicing without a license was kind of not really that solidified at the time that D.D. Palmer was developing all this stuff. And in his mind, I'm not him, I wasn't there, but he discovers this aspect with the spine. So at that time, mainstream medicine was kind of being pigeonholed into three main things: drugs, surgery, and pathology. And Dee Palmer is often this land of, well, I don't fall into the category of any of those, and maybe wasn't even claiming to be practicing medicine at all. And so his philosophy was not drugs, not surgery, and we're working with the innate intelligence of the body, and we're removing mechanical interference that can happen with the nerves that are coming up the spine. And of course, we know that the nervous system controls absolutely everything in the body, whether that's your heart pumping, your lungs taking in oxygen, your brain function. And so he just didn't fall into that category. And I think I try to think how it would have been back then with personalities and egos, and there ends up being this kind of fight to who gets to, or what is legitimate healing,
Yeah.
and around that time, medical doctors were getting places within government, and they end up getting more control. That's not really what chiropractors were doing at the time. And so they were considered at some point practicing medicine without a license, but I don't really know what they would have done. Who would license a chiropractor at that point? There weren't chiropractic schools. And even if the powers that be couldn't license them anyway, they weren't, experimenting with spinal manipulation and seeing the benefits from it and everything. And so it was a really awkward time for chiropractic. And we've had to mature as a profession. And somehow over the course of the decades, they survived. And, now we have very good schools. And many of them are extremely scientifically based. In my school, we had probably 9 to 12 different terms of courses that were what we called the evidence-based practice
Mm-hmm.
courses. And so we were taught how to read research articles, find the issues with them. And so my school was very much pounding in the evidence-based, make sure that this is legitimate science and stuff like that. And so over the years, I just think it's been an awkward coming of age, I guess,
Yeah.
for chiropractic. And some of that stigma is still there. But somehow within like the 1920s to 50s, the chiropractic was gaining popularity, and there were certain pockets of the population that apparently were finding benefit from it, trusted them, and chose that
Right.
route um, or it rather than mainstream medical, or in addition to.
Yeah.
But
Um, yeah, I find that so fascinating. And as I look at it and as I'm hearing you, I'm like, it sounds like it takes a lot of courage to be willing to go into this profession and in many ways. So I think that's really neat. So what's like the defining criteria of a chiropractor? Is it working with the spine? Is it working with the nervous system? Is it both?
mm,
Is it
that's an
is
awesome
osteopathic?
question.
Yeah.
Yeah. So when it comes to the chiropractic philosophy, most people are thinking, oh, they're spine doctors. And
Yeah.
in a sense, we are trying to target the spine, but it's what the spine is housing and protecting that we're really trying to help. And that, like we were talking about,
Mhm.
is the nervous system.
Okay.
And as I was thinking about the whole spine a little more deeply as this protective case, if we think about protective cases in our lives, maybe it's an eyeglasses case
Mhm.
or a gun case or something, that protective case is a solid. So in our lives, we see protective cases like eyeglass cases or gun cases. And they are just one continuous, solid, hard piece of
Mm-hmm.
protective gear.
Right.
But as far as the spine goes, it has all these different segments to it, and it's not rigid, it's movable.
Yeah.
And then what it's housing inside is very soft, vulnerable material. And that soft, vulnerable material can be um, open to being harmed depending on how much the different segments of that protective case are able to move or not move. And so you've got all these different complicated pieces of this whole protective system and very complicated movements that can happen with it. So that spine is supposed to be able to flex, rotate, and laterally bend, unlike any other protective gear we see in our lives. And because that whole system is built with individual pieces, and then we're trying to do this complex movement, we need all of those pieces to be moving together, kind of like we were talking about before with the muscles, and moving. So we need the spine to be able to move in a healthy manner, and certain things can cause those joint segments to be restricted and kind of stuck in one place. Sometimes that's muscles. Sometimes that might be postural changes. We could have bone spurs or osteophytes that have built up. These days, people are talking a lot about fascia,
Mm-hmm.
and its role in the body, things we
Mm-hmm.
didn't really understand
Yeah.
even just 20 years ago.
Yep.
So I think fascial adhesions can be a piece to why that spinal segment might not move properly. In chiropractic school, we're taught to do what we call motion palpation. And so, as an example, if I've got a patient laying on the table face up, then I can go and feel each vertebral segment and how much they can move anteriorly and posteriorly. Then I can go on either side and I can um, feel how much each vertebra is moving laterally. Then we can take the head and we can rotate and feel um, how those are able to move
Yeah.
in rotation
Yeah.
and find the restrictions. So our whole goal is to find the restrictions and help the body to move properly, in the hopes that that helps the nerves to move properly or be free from the restriction,
Right.
and then they can communicate with the organs. So in the chiropractic world, we have this term subluxation that we use a lot, which is, it also exists in the orthopedic world, but in the chiropractic world, it's got a slightly different definition than in the medical world. So we consider it a functional misalignment, and it's often not really that visible when we're looking at x-rays. It can be, but it's basically an anatomic disrelationship between one vertebrae and another vertebrae. In the medical world, a subluxation is an actual partial dislocation, and that's going to be very obvious on imaging, and typically that's going to be from a really bad trauma or injury. And so that's a term that we'll hear a lot within chiropractic, and that's kind of what we're dealing with in an adjustment, is finding these subluxations or these joint restrictions, and then helping that proper movement to be restored and the general health of the body.
So while we're talking about adjustment and adjusting, let's talk about the kind of the elephant in the room where
Mm-hmm.
people are very scared of adjustments because of the
Mm,
stories we have heard where people get paralyzed after a chiropractic adjustment. That's
yeah.
like, that's a big fear for a lot of people. But it's my understanding there's usually some predisposition occurring before somebody
Mm-hmm.
gets in that situation, and it's likely due to a combination of kind of freak circumstances coming together versus the actual adjustment is what caused it. Can you
Yeah.
elaborate on that?
Yeah. So there have been studies over the years, and they've kind of looked at people that had headaches or neck pain, and they looked at what did they do for the treatment? Did they go to the medical doctor or did they go to a chiropractor? And they found that whether they went to the chiropractor or whether they went to the medical doctor, there was no significant change in the risk of strokes. And strokes are one of the things that, could be a concern. But the research kind of showed that the bottom line is that vertebral artery that actually runs through those loops
Yeah.
of bone just within the cervical spine. Okay, so what they found is that that vertebral artery has already been weakened within that situation,
Right.
and that stroke was going to happen whether they had a chiropractic adjustment or whether they were in the car driving and checking their blind spot and had too much rotation. Because if you look at the anatomical situation of the cervical spine and that vertebral artery running through, it's actually the straight twisting that puts that
For sure.
artery at risk.
Yeah.
And so in a chiropractic adjustment, we're taught we need to utilize all vectors that we can. And so a chiropractic adjustment ends up being extremely safe for the neck when we use the lateral flexion and a little bit of extension or flexion, and then we hit the rotation. And so once you put that lateral flexion in, it puts that spine and that vertebral artery in a much safer situation. And so it's the chiropractic adjustments are just like taking that head and just completely rotating them without any other vector involved that ends up being the major problem.
Yeah. Okay. So myth busted, right? It is a myth that chiropractic adjustments cause that, either stroke or someone going paralyzed.
Yeah.
That it's a
Well, and the statistics are massive. I couldn't tell you what they are, but for the amount of cervical adjustments that happen in the US, in the world, whatever,
Mhm.
compared to the amount of strokes that have happened on the table, it's just an extremely high amount of adjustments compared to the amount of strokes that we have.
Yeah. Okay. So kind of in that same thread, what do you think from your perspective is the biggest myth of your work being a chiropractor?
Well, that one, and then also the whole idea of, well, once I go, I can't stop.
Mm,
Once I get an adjustment, I have to keep having adjustments for the rest of my life.
I've heard that one.
Yeah. And I'm not quite sure what aspect they're thinking of,
Okay.
whether that's like physically
Mhm.
you have to continue or you're going to be in a bad way,
Mhm.
or do they think that there's some addictive factor?
Mhm.
Because I mean, anything that feels good and makes you feel better, I guess you could end up in an addictive factor, but I don't really know anyone
So
that's
that's just something that
addicted to adjustments.
so that's just a myth that kind of took a life of its own, huh? That there seems
Yeah,
to
I
be
think
no
so.
yeah.
And then we kind of defend ourselves in the sense that it's like, well, once you go to the store and buy food, you're gonna have to keep going back.
Yeah.
Like once you fill up the gas in your car, you're gonna have to keep going back.
Yeah.
And I sometimes I compare it to having your teeth cleaned, brushing your teeth. There's just certain things that we do
Yeah.
for hygiene
Maintenance. Yeah.
to maintain our body's health, that are accepted. And for some people, they have the paradigm that I would like to maintain my spine. And how is that any different from I'd like to maintain the health of my teeth?
Yeah.
That we're just not quite there on the same
Yeah.
level. And granted, um, getting a spinal adjustment every week or every month or whatever is not going to put you at the same health risk as
Right.
brushing your teeth once a week or once a
Right.
month. They are of course in different categories. It's just having routine chiropractic adjustments is an option that someone with the mindset of this is my value, this is important to me, and that has some understanding and feel of um, this this helps me maintain optimal health. I
Yeah.
feel better, and my organs are going to be happier. My brain's going to be happier in the long run if I have that awakening and stimulation to that nervous tissue that
Yeah.
controls my whole body.
Right. Well, one of the things I wanted to talk about today, because I feel like what my intention is and what the purpose of the academy, the Holistic Nurse Academy is to bridge the gap between Eastern and Western medicine. Because I think there's a place for both, and I
Mm-hmm.
think they complement each other so well. I use both. I believe in both. So I want to have a little bit of a conversation right now about why is there this tabooness that I'm not allowed to talk to my primary care physician or my
Mm.
spine physician about my chiropractor without feeling some sort of like guilt, betrayal, or shame, you name it. They're never good emotions. I'm trying to figure out. I have a brother right now who's going through some major back issues. And my observation is that the worlds operate very independently. And
Mm-hmm.
I keep asking myself, well, why can't we work together? Why is there such a resistance to saying, well, you could try this path, you could try PT, you could try, we'll get an MRI, we try PT, you can have a consult with this, a neurospine doc, neurosurgeon. Something you could also try is go see a chiropractor. And I actually know a really good one. And this is, there's never that conversation. And I just can't understand why we're kind of left to our own intuition or
Mm-hmm.
research, kind of a mixture of both to find the right practitioner. So I'm just, or what works best for us. And I feel like that's how it should be in terms of we should be doing our own research and finding
Mm-hmm.
out what works best for us. But it sure doesn't hurt to have referrals and resources come from our medical professionals. So what are your thoughts on that? And
Well, I think we're still in the process,
yeah.
and I think we're way farther along than we were 10 years ago, and definitely 20 to 30 years ago. I hear stories of back in the 80s where um, chiropractor and his wife were out bowling, and they started uh, bowling with another couple.
Hmm.
And once that other, and I can't remember if the story, was that he was a doctor or not, but
Yeah.
once they found out that he was a chiropractor, they were like, hey, we are not friends with you, and just kind of shunned
Yeah.
them. And so I think we're just still on that path
Yeah.
to resolve the awkwardness in the beginning. And we've got these, I think it boils down to, are you on team A or team B?
Yeah.
Like, um, and then that pride gets involved. I think a human tendency, a really strong one, is that it's easier to think it's either this or that.
Hmm.
We put it in this box or in that box, and it's not as easy of a human mental process
Right.
to think it is both and.
Yeah.
These are, we can consider both sides. The natural side has a place, it has legitimacy. We are continuing to do more and more research on it, and the science is telling us, this is legitimate. But then, what does that say about the medical side?
Yeah.
I think there's that fear of, oh shoot, we're going to be replaced, which isn't really possible.
Yeah.
And
Yeah.
if I break a femur, I can't go have that adjusted, like, please give me the drugs and the
Yeah.
surgery. And so obviously there's a wonderful place, I mean, a vital place for drugs and surgery. Um, but I think a lot of it boils down to personality and ego. and pride, and
Yeah.
we're a bunch of humans trying to do work and to help people, and we all want to be the ones with the answers and the ones
Yeah.
that, make that shift for someone, and I think we all deal with it, but some personalities just have a harder time with, you know sharing that responsibility, and being okay with it, and
Yeah. And
just
I think
humbling
that's a really good
ourselves,
point. Yeah. Humble ourselves. Um, do a little inner work to say, what am I so threatened about? And,
Yeah.
I think for me, it takes a huge burden off me. Like I've gone to nursing school. I've, like you, continued my education post nursing school, and I keep learning and I keep diving into things. And I'm still okay to say, I don't know. But
Yeah.
here are
Hmm.
some resources. I think that's really actually empowering to be able to admit, like, this is outside of my capacity or even my
Hmm.
scope. And, but who might, this might be an option for you, worth exploring. So I just think that's like a healthier, better way. And I'm just hoping that we can open up this discussion amongst us to use each other as resources, realize that there's an abundance of them, and that we all have our skill set that can help heal people, get people back to well-being and feeling better, that doesn't threaten the other's opinion, knowledge, scientific basis,
Hmm.
all of that.
Yeah.
So, yeah. Any other?
Yeah. I think a lot of times, practitioners can feel that it's an insult to their intelligence,
Yeah.
if they didn't have all the answers. And I myself have struggled with, feeling confident enough, because I feel like, oh, I'm not legit unless I know everything.
Yeah.
And just recently in a chiropractic lecture and some continuing education courses, they said, look, like, as a chiropractor, you are, far more susceptible to, what's that term they use these days? The imposter syndrome,
Mhm.
and being insecure about that,
Mhm.
because there are pieces of chiropractic that in some pockets are still considered a little bit voodoo, but, um, every time I am hearing of it with my patients, and it is becoming more and more common, but we still got a long ways to go. I am hearing patients say, "Oh, yeah, my doctor suggested chiropractic, or go explore this or whatever," and normally
Yeah.
my jaw drops, and I'm like, "Are you serious? Can I have that doctor's number?" Because that's a doctor I personally would
Would
trust,
trust. Yeah.
and I would trust sending my patients who are in my office for a reason,
Right.
because they have this particular paradigm, and so I would feel comfortable sending them to someone like that,
Yes.
who is in the other world on the other team, you know?
Yes.
And, but I think one thing that if we could all remember as practitioners is, when we tell a patient, I don't know, most of the time I think that's going to come across as comforting, and help them trust us better.
Uh-huh.
Like,
Mhm.
hey, they can admit they don't know, and that's something I've gotten more comfortable with. You know what? I'm no expert on Lyme's disease, or
Yeah.
whatever it is, but here's some things I do know, and I can direct you this way. I can't
Yeah.
help you with certain pieces, but that's what I've got, and
Well,
that is
yeah.
okay.
And I think
And
that's a good point as patients, that we need to be okay with that answer as well. I think in
yeah.
general that is an okay answer, but we need to give our practitioners permission to say that and not feel shame or guilt or
Mhm.
embarrassment. And go, I appreciate you saying that. Do you have any
Mhm.
suggestions, or any other thoughts? And I pride myself in being a resource to people, not just the one that's going to, fix all the things. So, I know for me, I just want to share my personal experience where I've had my own journey with back issues, and I followed the traditional path for a very long time. Um, and I felt like I got a pretty good right diagnosis. The treatment was suboptimal. It wasn't like it sort of helped. Um, but I was still determined to figure out, is there something that can get me further and make me feel better?
Well, and
And
did your intuition speak at that?
yeah, there was just like,
That's
there's more to this.
mm-hmm,
And I felt like I was in good hands and that the people I was talking to were good to me. But I felt that like we've reached the end of our road and we have no other
mm-hmm,
suggestions. And then that's where I met you. And I mean, we already knew each other, but I got reacquainted with your work, and you introduced cold laser therapy into my
mm-hmm.
program. That changed everything for me in such a positive way. So I'm like, gosh, I just wish that I could say to my spine team, like, I can't tell you how much cold laser therapy has helped me, and my chiropractor offers that. So,
Mm-hmm.
um,
But you don't feel like you could.
no, yeah, no. And I think that a lot of
Well,
people feel that way,
and I
but,
think a
but
lot
I
of
can here on this
personalities,
podcast, and I'm saying it now.
yeah, yeah, yeah. As long as you're getting it out
Getting
somewhere,
it
right?
out. Yeah.
But I've heard a lot of patients say similar things, like with the cold laser. They had some surgery. There's pre-op and post-op surgeries or surgery settings that we
Mm-hmm.
can do, certain frequencies that help the healing be faster and help on a cellular level
Mm-hmm.
and everything. And they go in. This one particular patient went in for her post-op 2 weeks out, and normally this is a 6-week healing process. And the doctor said, "Oh, you're 90% healed at 2 weeks. So you must be a super healer." And inside she's like, "I'm not a super healer. I know what happened. I was lasered. I am not. This is very unusual for me." But she didn't feel like she
She
could
could
say
say
that to
that.
him. And I think the bottom line is, I don't think they care.
Yeah.
I think the patients, like, they don't care, they will
Yeah.
ignore it or they'll mock it. And I'm not interested in, I don't need to waste my breath or my
Right.
energy if they're not going to care or they're going to mock it. And a doctor in our society these days, it has not always been that way, but we are considered for many people an authoritative figure.
Mm-hmm.
And for that authoritative figure in your mind to discredit what you've done doesn't feel that good, if that's the approach and personality of that
Right.
practitioner.
Right. Yeah.
But
Well,
all the um, obviously every doctor is different and
yeah.
would
Well, I would like to
respond
set the
differently. But
intention through this conversation that we're bridging that gap and that those recommendations can be made with confidence, and it actually builds trust with providers and practitioners and patients. And,
mhm,
and that which includes me when I'm the patient, that builds trust. So I like that
yeah,
you brought that
well,
up.
and I think one thing a patient could think about, like in your situation, when you're going, what do I do? Are we at the end of the rope? um, are there other options and whatnot? Or you have a situation and you're wondering which direction to go. I guess a good question to ask yourself is, okay, if I approach this through the medical mainstream arena,
Mm-hmm.
is there any chance that what I'm doing there is a band-aid, that I'm covering up a deeper problem and ignoring something? Or do I need to go find out what the root cause is?
Mm-hmm.
And because we aren't always putting a band-aid on something in mainstream medicine. Sometimes that's what's happening, and sometimes we're not. With a broken femur, you need some major surgery. That's not a band-aid fix and ignoring the gaslight in your car. That's we've actually got, that is fixing, a
Right.
problem. And then, just asking yourself, is this a situation where I could be, covering up that gaslight and ignoring a problem by masking it with a drug or,
Yeah.
something like that?
Yeah. So root cause, like you said, that's your goal. Your goal is to get people feeling well enough that they're back for maintenance and not the continual issue, right?
Hmm.
Is that true?
Yeah. Yeah. Well, and I would say that these days, with all that we're exposed to, with environmental factors, with the, you know, horrible food we eat, there's a lot of different things these days that are so different from, 50 years ago, 100
Yeah.
years ago. And because of that, our ligaments are weaker, our tendons are weaker, our muscles are weaker, and we don't even have the raw materials in our environment to be able to rebuild back proper tissue. And so I've heard chiropractors say that were practicing in the 80s and have kind of been through these decades, the chiropractic adjustments just aren't holding like they used to.
Uh,
And so they think, I think in general we have, and we know this, our bodies and our tissues in the population are just not as healthy and strong as they used to be. It's like I'm building a house out of styrofoam bricks instead of concrete, or
mhm.
normal brick. And so one thing that I think people have to keep in mind these days is it's probably going to take longer to heal. And it takes more effort to be healthy these days in many ways than it might have decades ago.
So that would be a lead into why you have studied more of the nutrition side of things, right? Would that be?
Yeah.
Yeah.
Yep. And so just as a side note, some of the things I need to do to get a muscle to fire properly may need to be to fix a nutritional deficiency. It might be, we've got too much of a pathogen, whether that's mold, fungus, yeast, bacteria, virus, heavy metals that are literally sitting in that area within the body. We've got to go clear those out to some degree, and
Hmm.
I don't have all tools, but there are some tools that help to lift that burden just enough to help that muscle to function properly and have that connection back up to the brain. And so there are many times where I'm working nutritionally to fix the musculoskeletal problem because I've got to go strengthen tissues in order to get some pain down or
Hmm.
whatnot. But
Yeah. Well, and that kind of leads us into, hopefully, in the next little bit here, you'll be hosting a class on our website about nutrition and
mm-hmm.
some basic nutrition principles. So,
Yeah.
um,
And physiology really in
yeah.
general, like how how is nutrition actually physiology? Like that's how our
Mhm.
body functions is through nutrition.
Yeah, I love it. I agree. It's very important. Um, as I'm listening to you, it's fun because, I do cranial sacral therapy and there's so many correlations between what you're saying and how we work.
Mm-hmm.
We're the light touch modality where, you guys can get in there and do, I guess, deeper adjustments or,
Mm-hmm.
um, like we're often told the weight of the nickel is our pressure, but it's a palpation technique. And our palpation, our hands become the instrument and we are palpating like the cranial sacral rhythm and um again, like you were saying, increasing mobility is a big part of what we're doing, working with the fascia, um,
Mm-hmm.
to lengthen and stretch and release restrictions in the body. So there's a lot of similarities in that way. So I think that
Yeah.
it's
Well,
fun.
the last time I had you work on me, you explained a few things, and I can't remember which pieces at this moment, but
Yeah.
you explained a few things where I was making the connection between cranial sacral and chiropractic,
Yeah.
and also the separate benefits
Yes.
of cranial sacral
Yes.
that chiropractic maybe not hitting as well,
Yeah.
or
And vice
in
versa.
some
Yeah.
cases not at all, you
Yeah.
know.
Yeah. So, but I feel like I can talk a little bit more intelligently on it because I've been studying that. So that's fun.
Hmm.
Um, is there anything else you want to share about your journey or chiropractic work, or as we start to wrap up
Mm,
and finish this conversation? I really appreciate your insight and what you've shared so far.
well, I think that's about it.
That's a good
I'm
cover.
sure there's a million other things I
I
could say,
mean,
but
yeah, we could really go down a rabbit hole, but we don't want
many
this.
different rabbit
Yeah.
holes.
We could make this a Joe Rogan podcasts of like
Oh, for
3 to 4
sure.
hours easy, right?
Conspiracy theories and
But no,
all of
but
that.
alas, we're just gonna keep it
But that's
short for
not the
the
purpose,
no,
right?
no, no, no. Well, you are wonderful. I've seen your work in action, and I know you're you're doing really good work, and I'm really grateful for
Well,
you
thank
and
you.
my own personal healing journey and the help you've given me.
Well, you
And
as well.
yeah,
We all need all of us.
we
Well,
do.
and maybe that's another point is that as practitioners, as nurses, whatever profession you're in, we have that saying, physician heal thyself,
Yeah,
right? And one thing I've learned over the years is, of course, there's action that we need to take, that is, the maintenance stuff. We need to keep up on our bodies, and we need to
yeah,
make healthy choices. But there's some things that we just need another hand at.
yeah,
Whether that's fixing that broken femur, we need someone else to do that,
yeah,
or going to a chiropractor or a craniosacral therapist, a massage therapist, like. Um, I think as this world is just built to rely on each other,
yeah.
serve each other, and help each other. We just can't be everything
No,
for ourselves all the time. It's just not
no.
possible.
We are meant to have a witness to our healing, whatever that looks
Hmm.
like.
Yeah.
And I just, for me, I just want to say that I am walking the walk. So I do have a primary care physician. I, do what we would call traditional Western medicine, but I also have my go-tos for the Eastern medicine.
Hmm.
And I love it all. And I think all that I do for myself. So some people are really into yoga, some people are really into acupuncture. And the thing is like that's where the magic is for me. It's like the art in
Hmm.
the medicine is playing with these different modalities to create this symphony that comes together that works for
Hmm.
you in your situation. And we're all too individualistic and we're simple, but we're complicated at the same time. And we deserve to have options and we deserve to look into anyone that might make us feel better
Hmm.
and get us to our healed whole self.
Well, because no one is going to know better than you.
Right.
All information sits within your cells,
Right.
and you are the one that has the best access to that. And
Right.
I think over time, if we choose to, we can practice that intuition and that perception of just paying attention and listening to what's
Yeah.
going on, and then doing that discovery journey, the research, the even just trying different things, different modalities that you feel drawn to,
Yeah.
and just kind of experiment. And that I think is kind of our playground, is
Yeah. It really is.
just trying the different, because there's so many brilliant people on this planet, and I think they are taught from whatever source you want to call that, and given gifts,
Hmm.
and then they end up sharing that with us, and certain techniques and certain modalities. And I mean, I'd just love to know all of them, because
Hmm.
I think there's, even in some of the ones that might seem a little weird at first, there's things that I do for my patients that seem really weird, and I joke with them. I have them do certain things, and then I'm like, smile, you're on candid camera, because it's weird.
Yeah.
But then if I explain the reason behind it and what our goal is physiologically, then it's like, oh, that's
Right.
no longer weird anymore. Like,
Right.
once you have the explanation behind something and the reason. So anyway, it's just all a big adventure of,
Yeah.
if you choose to enter into the alternative world,
Right. Well, have an open mind, be playful about it, and see where the road takes you, in my opinion.
Hmm.
So, well, I again appreciate you being here. For those of you
I love
listening,
being here.
for those of you listening, we will have a class by Dr. Aubrey Madsen up on our website, hopefully in the near future, on the basics of nutrition and, like you said, the physiology, pathophysiology, how we can work with our bodies through nutrition to optimize our health. And I'm looking forward to that because more and more of that's becoming really important. So
Yeah.
until then, you can go to our website, holisticnurseacademy.org, or you can find us wherever you find your podcasts, Spotify. We are on YouTube as well and Substack right now. We're working on the iTunes podcasts, but otherwise you can find us on our website. So thanks again, and
Awesome.
we'll talk to you soon. Have a great day.
Bye.
Bye.